We have all heard about the false tragedy of Poonam Pandey as she was killed by cervical cancer. What is cervical cancer?
Cervical cancer is the cancer of the lowest part of the uterus, या बच्चेदानी, ठीक है? And it is the fourth most common cancer in the world. The important thing about cervical cancer is it is and can be preventable, or perhaps the death rate and the severity can be reduced tremendously by this magical vaccine, which is the HPV vaccine.
What does the HPV vaccine do?
So HPV vaccine, you have to know the etiology of cervical cancer. The etiology of cervical cancer, that the most common cause is the virus, which is the HPV virus, which affects and which is the main cause of cervical cancer. So the HPV vaccine came up, which was protective against four HPVs initially, which came up with the Gardasil 4. Now is the Gardasil 9, where we are protected against 9 HPVs. And they not only prevent and protect you against cervical cancer, it protects you against penile cancer, about vaginal cancer, vulval cancer, the oral, the throat cancers as well.
When should the vaccine be given in India and foreign?
So we can give now. The vaccine has come into the immunization schedule. It has to be given 3 years before you're sexually active, ideally between 9 to 11 years. When you're below 11 years, 2 shots of the vaccine is given at 0 months and 6 months apart. When you are between 15 to 45, which is the extended age group is 45, you give 3 shots at 0 month, at 2 months and at 6 months.
What are the side effects of this vaccine, as it is so good in all the grounds?
There are 3 types of side effects which are very, very minor. There is minor side effects like at the local site of injection. There can be pain, there's burning at the site. There can be there could be gastric side effects like nausea and vomiting, and there could be slight side effects like headache, and there could be also fainting episodes. What I want to also specify is that if you're sexually active, then also you need to take the vaccine, because if you're affected by a certain type of HPV, it will cover you from the rest of the HPVs. So another question that comes in is that, is the PAP test important still if you're taking the vaccine? Yes, the PAP test, or the cervical cancer screening method, which is the PAP test, needs to be taken in by all women above 21 years. And even if you're taking the vaccine, you still have to undergo the PAP test. Thank you.